This lecture is for the LVN to RN program using the Claywell book, Critical and Diagnostic Thinking for Better Clinical Judgment. These are the three objectives for this lecture. Explain the importance of critical thinking in nursing, identify the types of reasoning based on critical thinking, and describe the role of cultivated thinking in critical thinking. Definitions of critical thinking with Red Critical Thinking Model. Critical thinking is purposeful and rational. It sets out to accomplish a specific goal. This goal-directed process of inquiry uses available facts, principles, theories, and abstractions to analyze, make inferences, solve problems, or arrive at decisions. To think critically, think red. Recognize symptoms, evaluate arguments, and draw conclusions. The RN must understand and incorporate into practice to ensure that decision-making process will lead to the best possible outcomes. The need for critical thinking is to decrease errors and sentinel events and to improve patient care systems. It's to give careful, complex consideration of what must be done and how best to do it, and for evaluating nursing care. Types of reasoning embedded in critical thinking. Reasoned thought is discriminating, prudent, and does not allow emotions, feelings, or prejudice to skew decisions. Nurses who practice reasoned thought recognize when negative factors may be interfering with their ability to think clearly. Clinical judgment is a perceptive understanding of a situation based on knowledge, empirical data, that's data that can be observed or experienced, theory, and scientific inquiry. It helps decide whether to proceed with or revise a course of action. Critical thought is experience, knowledge, and skills required in order to think critically. It is a disciplined rationale and self-directed activity that uses standards and criteria. It assists the nurse to make more effective clinical decisions, and nurses who engage in critical thought will meet more of the patient's needs and affect positive patient outcomes. Diagnostic thinking is flexible and embraces complexity. It is based on the scientific process but uses both analytical and intuitive cognitive processes. The characteristics of diagnostic thinking is the ability to grasp and analyze the complexity of any given situation. It uses all of the data at hand to make both inferences and deductions. Cultivated thinking is engaging in critical thought. It is the thought that is organized, enlightened, and educated, and does not assume that all pertinent information has been gathered yet. It seeks the latest and best information available to make the most appropriate decisions. An RN who continues to update data and stay well informed will best meet the patient's needs. Deductive reasoning. This is a process of going from broad information to specific details or from general to specific. Deductive reasoning takes general assessment data, draw conclusions, identify problems or needs, and formulates a plan. An example is the nursing process, because it involves taking data and deducing a plan of care. Inductive reasoning occurs when a patient presents with symptoms or problems the nurse has seen before. From the assessment data gathered, the nurse makes inferences, conclusions, or assumptions that ask further questions and makes decisions. The strength of the inference is based on the extent of the RN's knowledge and experience. This goes from specifics to generalities and infers the most likely outcomes based on the supporting data. Listed is 8 elements of reasoning and critical thought. Purpose recognizes that all thought has an agenda or asks the question, what are you trying to accomplish within the context of your thought processes? The question at issue defines the purpose clearly and accurately. Available information is based on information and data that are at hand, which can give a greater understanding of the problem. It also gathers historical and assessment data from the patient, as well as seeking all available secondary source information. It assists the critical thinking nurse to support the plan of care and understand the potential outcomes. Interpretation and inferences are conclusions that result from or is a summary of the process. Concepts begins as the thought process develops, and concepts form that begin to explain the problem at hand. These ideas, theories, or mental images of something do not yet have a tangible representation. Assumptions are educated guesses, hypotheses of stated or unstated beliefs that are accepted or held as a truth without proof. Implications and consequences are divined through outcomes and are expected or unexpected. The point of view explains or illustrates how the data can be understood from multiple positions. Structure of critical thought is critical thought that is fluid and circular. The critical thinking processes questions that are formed at each step of the nursing processes. It prioritizes decision making and is the foundation to save lives. This can mean the difference between living and dying. A paraphrase quote by Mark Reed is that you study not just for a test, but you may be the only thing between the patient and the grave. When you learn to be a critical thinker, you will save lives. Attributes of the critical thinker. Curiosity is the desire to understand what something is or how it works, to be compelled to explore beyond what is immediately obvious. It may also imply skepticism, or the need to challenge beliefs in search of other possible conclusions or truth. It is a relentless pursuit of truth that keeps an open mind, looks freshly at the world and our patients, and to practice discovery every day. It does not prejudge. Reflection is looking back and reconsidering ideas, thoughts, beliefs, and actions. It helps the nurse improve practice through careful self-critique of prior scenarios. Diligent pursuit of evidence and information seeks relevant data as part of the process of decision-making and collaborates with experts and consults other references while developing the plan of care. Rational thought is knowledge gained through study and experience. It helps a nurse predict the likely outcomes of planned actions or interventions. It is related to making sound clinical decisions based on available information. Creativity is the ability to be inventive, resourceful, and inventive. It recognizes patterns that are present, but understands that outcomes are often uncertain until tested. Intuitive thought involves one's sixth sense, their instinct or insight. Intuition implies perceptiveness, the ability to see or sense subtle patterns or characteristics, and this can be referred to as that gut feeling. 6 critical questions. Things to think about when someone has something to say. Who? Who said it? Is it someone you know? Someone famous? Someone in authority? Should it matter who said it? The what? What did they say? Did they give facts or opinions? Did they give all the facts? Did they leave something out? The where. Where did they say it? Was it in public or in private? Did other people have a chance to talk about the other side? The when. When did they say it? Before, after, or during an important event? Why did they say it? Did they explain their opinions? Were they trying to make someone look good or bad? And how did they say it? Were they happy, sad, angry, or just didn't care? Did they write it or speak it? Could you understand it? Fostering critical thought is a process rooted in discipline. It's exemplified by being true to the standards of thought, testing one's thought process for clarity, accuracy, specificity, relevance, logic, consistency, depth, and significance. It is the individual's RN responsibility to develop critical thinking skills. Your nursing theory and philosophy, because nursing theory guides your growth as an RN. And it will be up to you to choose a nursing theory most in line with your beliefs and appropriate to your practice. This provides the rationales for why you do what you do and serves to guide your nursing practice. Developing a personal philosophy of nursing will require examination of your personal beliefs and professional practice and will reveal your growth as a nurse. Here's an NCLEX question. After a nurse gathers data from the assessment and identifies needs, the nurse develops a care plan. The nurse is demonstrating which type of reasoning. So we have inductive, intuitive thought, deductive, and point of view. Now we look that this is asking what type of reasoning. So the first 2 that I'm going to put to the side here are going to be 2 and 4. Intuitive thought is often linked to critical thinking. Remember I said that was about one's sixth sense, their instinct or insight. That intuition is perceptiveness, the ability to see those subtle plans and characteristics. Remember also that was your gut feeling. And 4 is taken out. An enlightened thinker is able to interpret data and clarify meaning from several points of view. That is to explain or illustrate how the data can be understood from multiple positions. A point of view is an element of critical thinking. Looking at now between 1 and 3, between inductive and deductive. And the correct answer is number 3, deductive. Taking general assessment data, drawing conclusions, identifying problems or needs, and formulating a care plan comprise deductive reasoning process. Inductive reasoning is when we take that assessment data that we gathered, and the nurse then makes inferences, conclusions, or assumptions, is going to ask more questions and then make decisions. The nurse uses inductive reasoning to go from specifics to generalities and infers the likely outcomes based on the supporting data. A nurse wants to develop attributes of a critical thinker. Which attributes should the nurse practice? In NCLEX, you're looking at what is the question asking for. So basically it's saying, what are the attributes of a critical thinker? We can use number 1, intuitive thought, predetermining purpose and diagnostic thinking. 2, concepts, assumptions, consequences. 3, rational thought, inferences, implications. And 4, reflection, creativity, and curiosity. The first 2 that I put to the side here is going to be 2 and 3. For number 2, all of these are elements of reasoning and critical thinking. So take out number 3. Although rational thought is an attribute of a critical thinker, inferences and implications are elements of reasoning and critical thinking. So remember in NCLEX, if one part of the answer is wrong, the whole answer is wrong. Now you're going to look at between 1 and 4. Between 1 and 4, the number 4 is going to be the correct answer. The nurse who engages in critical thought does so on a foundation of knowledge and other specific attributes that supports a process, including curiosity, diligence in the pursuit of evidence and information, rational thought, reflection, creativity, and intuitive thought. Number 1 is wrong. Even though intuitive thought is an attribute, the purpose is an element of critical thinking reasoning, and diagnostic thinking is a related thinking skill that supports critical thinking. Predetermining is not a part of critical thinking. In fact, not prejudging is a requirement.